And the whole municipal hospital in the Volta region has partially suspended operations at its accident and emergency unit and outpatient department as well after 2 patients tested positive for COVID-19. This was to make way for disinfection exercise at the 2 departments to prevent possible spread of the virus. According to hospital authorities, operations at the department would resume fully by Saturday. Our correspondent Fred Kwame Asare is joining me right now for a quick update on that. Hello, Fred.
Yeah, hello, Gifty.
Fred, so tell us, how did this happen and when?
Well, I was at the facility earlier today, and then they confirmed the case to me. This happened yesterday. I was told that 2 patients reported at the facility on different occasions, but that was yesterday. One came for a review. She was treated for malaria, but then when she reported this, they realized that she had some symptoms and that they should conduct a COVID-19 test on her. Then she tested positive. Another person was also, or the other person was referred from a smaller facility who also reported at the whole teaching hospital. And then upon further treatment, they tested her for COVID-19, and then she also tested positive. So at the moment, the 2 have been moved to the whole isolation center where they are receiving treatment.
What do we know about these 2 patients, apart from where they were referred to, from where they were referred, I should say? Do we have any other information about them at all?
No, well, authorities are tight-lipped on releasing information on the 2 patients. All they told me was that one earlier visited the facility for a malaria treatment, and then the other was referred from a smaller facility.
So the hospital at the moment, the emergency center, the OPD have all been closed down. Does it mean that there's nothing going on at the hospital at the moment? It's closed to any other patient?
Exactly. When I visited the facility earlier today, both departments, that is, like you rightly mentioned, the accident and emergency department and then the outpatient department were closed. I saw one guy who was undertaking a disinfection exercise. When I spoke to the authority, they mentioned that the exercise would go on the whole of today, and that after 24 hours, they would resume operations at both departments. But at the moment, both departments are not operating. I was also told that staffs at both units, that is, the OPD has about 17 health workers, and then the accident and emergency unit had 16. All these staffs have been asked to self-isolate, and then also samples have been taken for a COVID-19 test, and then they are to self-isolate for 14 days.
So this is an issue of main parts of a hospital being closed down, and a good number of health professionals also having to self-isolate. Certainly, this is going to take a toll on healthcare delivery in the region.
Exactly, Gifty. When I spoke to the man in charge, he told me that, well, they have no option but to ask the staff to self-isolate, with the sense that they don't know their status, and that perhaps if maybe they are infected, there will be a possible spread. But then he also mentioned that, be it that it may, they have to realign their staff at the moment. Perhaps those who are at other departments would have to be moved to the emergency and then the OPD department to ensure that they are able to deliver services to clients that would visit the facility when the departments are when the department resumed operation.
Yeah. Before you go, give me a quick idea how many people, you know, an estimated number that depends on this health facility for healthcare.
Well, it is one of the biggest facilities in the whole municipality. I should see people in neighboring communities and who actually visit this facility. So, on the average, about 300 to 400 patients would visit this facility daily for healthcare delivery. So this suspension of operations at the OPD is actually going to affect health care delivery in the whole municipality. But then authorities are assuring that by close of tomorrow, the place will be ready for operations, and that people or the public shouldn't be terrified or panicked. But then when they resume work, everything will be okay, and that they can visit the facilities for treatment.
Kwame, thank you very much. I see from the visuals that we have at the moment some disinfection going on already, which tells us that it has started.
Exactly, it has started.
Fred Kwame Asare is our correspondent in the Volta region there, joining us with details. The whole municipal hospital has been shut down for disinfection after two COVID-19 cases were reported there. So you can imagine the effect on healthcare delivery. I mean, this hospital is closed for the entire day. So if you have an issue, if you have a condition today, where do you go to? The health personnel have been told to go into self-isolation. This is why we must all take this seriously and do what we ought to do as we look to reduce the spread of the disease.